Well, aloha and good afternoon, everyone. My name is Danielle Bergen, and I'm the community coordinator here at Mental Health America of Hawaii. And we are happy to welcome you to our brown bag lunch today. We have Dr. Adam Coles with us today. He is a child and adolescent and adult psychiatrist who works at the Maui Family Guidance Center for the Hawaii Department of Health and is also the clinical director for IPONO. Dr. Coles will be presenting today on the current trends in concerning habits with youth substance abuse. And this training will explore the current trends concerning the youth habits these days. So Dr. Coles, I am just going to slowly let people in and then turn it over to you.
Cool. Thank you. Thank you, Danielle. It's always good to join these brown bags. Can everybody hear me okay? Just thumbs up. Good. Okay, cool. Thanks for joining me. I'm very happy in one way with myself because I've had an aspirational goal of having less than 20 slides, less than or equal to 20 slides for the past 16 years. I've never hit it, but I did this time. Maybe there's too little information, I don't know, but I was sort of like, yay, trying to stay away from huge blocks of text and things like that. Just to let folks know, this isn't going to be a comprehensive review of like substance use disorders in youth. It's more just kind of like what kinds of things have been popping up on my radar in my work with adolescents, just sort of like in the now and the recent past. What's going on, what kinds of things am I worried about, and why do I worry about them? And that's because things are always changing, and some things don't change, so I'm not going to comment a lot on things that have been very consistent, although I'm happy to talk about it in the discussion. The other goal is I'm hoping to take maybe only about half the time today with the actual slides. And so if people have questions or they've seen something in the community, this is also my opportunity to hear what you guys are worried about in the community, and I'd love to hear about it. And if I don't know anything about it, that's really important for me to hear about so I can look into it. So this is also about like kind of polling everybody, and so let me know what you're seeing out there, and we can kind of talk about it and develop some ideas about sort of what to do. So I'm going to focus on just kind of a handful of things with a couple of general, areas of just to refamiliarize ourselves. So I didn't do a real table of contents slide. I'll just kind of take you through it verbally, but let me share my screen and then I'll start the slides. As Danielle said, I'm what they call a clinical lead at the Department of Health Maui Family Guidance Center of the Child Adolescent Mental Health Division. So it's the longest title I've ever had in my life. But unfortunately, I'm no longer, not unfortunately, it was a good evolution. I'm no longer the medical director of IPONO Maui. I am still affiliated with them on the development side, the nonprofit side, but it was just the combination of the two jobs was starting to wear away at life. So with my daughter graduating from high school, I decided it was time to get some time back. And I believe Dr. Brian Taliho is providing some good service over there as their new part-time medical director, the last I heard. So let me share the slides. There we go. Can everybody see this? All right. So I'm going to chat a little bit about some recent national numbers, and then move into more Hawaii specific. We have a unique environment here that sort of gets trends and things from both sides of the Pacific, which I think makes us both more at risk, but in some ways it gives us more data to work with, and some unique, I think, resilience factors, which I'll talk about later. Just to look at kind of a recent national snapshot, pretty much everyone in my business is worried about middle school, and sort of growing more about middle school than the high school age group. Drug use among 8th graders increased 61% in the last 4 years before 2020. I don't have the best data. There's some accumulating data from 2021 to 2022 that's still on the rise, but those numbers are still being tabulated at the state. And although use is still high among high schoolers, we think it's probably decreasing, at least since 2019. But still, a very high percentage, 62% of high school seniors report abusing alcohol, and at least half have taken a drug, including alcohol, at least once. Some more kind of numbers to fill your head with, more locally. So looking at Hawaii, just a kind of snapshot in the last about 30 months, about 11% of Hawaii youth report a probable substance use disorder based on their self-reported symptoms. And this is from the Hawaii Student Alcohol, Tobacco, and Other Drug Use Survey completed last year. Just over 7% in the teenage group report using drugs in the last month, and a huge number of them, that self-reporting cohort, used marijuana in the previous month. Almost 12% of 12 to 17-year-olds report using marijuana in the last year. Comfortingly, a relatively small number of folks report using cocaine, methamphetamine, or heroin use. Although I want to put a caveat on that, self-reporting of methamphetamine abuse is low, despite the rate being, higher than is reported by folks who use. So I think that number is artificially low. There is a growing contingent of folks who are using pain relievers, whether they're diverted primarily, from like family members who have a prescription for hydrocodone, oxycodone, or a primary diversion out in the community, black market pain relievers. That use has been growing, and they're also being mixed in with other things, so crushed up, powdered, and then administered in various ways, whether smoked directly, dissolved in alcohol. That's the one I've been running into more lately, which is a great concern. And then a surprisingly lower number of folks reported using alcohol in the last month, although I think that's probably artificially low too. We are still, and it's actually been over a decade that Hawaii's been running lower than the national average, but for all drugs and alcohol use, between 10 and 14%, depending on what drug you look at. So looking at the general average. However, you have to remember this takes into account the very large cities, on the mainland, including LA, New York, San Francisco, Seattle. So those areas tend to be rather high. So being lower than that kind of overall national average, and the population density is very high. So most drug users are in those large metropolitan areas. And, the largest city we have in Hawaii is Honolulu, which is still not very large compared to some of those areas. So I think if we were to kind of reanalyze some of that data with regard to areas of similar population density, we might not be doing as amazingly as this number initially says. But not having done that analysis, I can't say that for sure. I just suspect. But the good news is the trend has been negative. So it's been improving since a peak about a decade ago. Actually, sorry, over a decade ago. I'm going to move this because I'm having trouble seeing. There we go. Okay. Sorry, you guys were blocking my view of my own slides. Okay. Also, which has not changed, the most at-risk folks for substance and alcohol use remain those of Pacific Islander, Native Hawaiian, or mixed part Hawaiian, Hispanic, or Latino ethnicity and ancestry. And that really has not changed in well over a decade. and remains our highest risk population. I'll talk a little bit about that later, and we can discuss that in the discussion portion. Of greater concern for me is of those reporting use and probable substance use disorders. Not very many reported receiving any help. Now, the survey didn't really pull out exactly, although there were some questions about, have you asked for help? And if you did you get help? But the number is still too low. Less than a third reported receiving help. But of those who did, many got help at or through school, which is both good to know that that's happening, but also makes sense, for us to where to put kind of resources when we're at it is maybe focus, on that school environment, because that's where we know many kids are going to be. And that's not new information. We've known that about that for some time. So one of our goals is to expand kind of our coordination with school-based health providers and school-based clinics. Also, not surprising, a significant number of folks who report substance use also report symptoms of mental illness and mental stress. I thought I sort of had a sense already that alcohol use, first use, was declining in age. I didn't really grasp how bad it's been, but I was surprised to see that the peak has moved down to 8 years old. That means that folks younger have used alcohol for the first time, just that the peak is at 8 years old now. It used to be like 11 a few years ago. It's been going down about 2 to 3 years every decade. And then there's a second peak of first use between 13 and 15, right in that kind of middle school to high school transition age. And then again, middle school is where a lot of folks try marijuana and other drugs for the first time. And marijuana first use age has also been declining. This is somewhat, I won't say new, but in the last decade, vaping has taken over, as the most common and frequent delivery or use method of various substances, including nicotine, cannabinoids. And, human beings are just very ingenious and are able to take these devices and re-engineer them to basically atomize anything. Prescription medication, pills, methamphetamine, and re-engineer these to vaporize them, and deliver them in a very high concentration. So we'll talk a little bit more about vaping and e-cigarettes later, but it's a very concerning kind of method of delivery. The methods of acquisition remain basically the same, no real changes. Paying others, who have access, whether through dealers or direct, have a legal license, can go to a drugstore or liquor store, and then obtain those and give them to whoever asks for them. Contacts through school, and obtaining or stealing from a family member or extended family, home, or neighbors. So I want to shift a little bit to talking about opioids before I talk about kind of one of my main concerns these days. This is more of a kind of just a global review. There are three main types of opioid receptors. I say main types because there are some subtypes. And for a long time, they were called delta, kappa, and mu. And then I want to say the early mid-90s, the nomenclature was proposed to be changed to more of a contemporary method of naming by number. So opioid receptor 1, 2, and 3. It hasn't really taken off. Everyone loves the Greek names, which is fine. Who doesn't? I love Greek. So I list them both there so people can refer to those and know that they're basically talking about the same thing. I put a little star by the mu receptor so that we can remember it. There are multiple opioid receptors with different action at various points in the body. And this graphic kind of gives you a sense for really how widespread they are throughout the body. And that helps explains why you get some of the symptoms that you do with these. by and large, they act in a depressive fashion, meaning they down-regulate the action of various systems in the body, which is why people use them. They downgrade, pain receptor activity, which explains, their pain relieving characteristics. They are relaxing to the respiration, to gastric motility. So when folks are having, withdrawal symptoms and things like that, they've used them in the past for things like diarrhea, rapid breathing, sweating, things like that. But that also explains all the side effects of an overdose, which we'll talk about, but very widespread effects throughout the body. So probably very few people are surprised that I'm concerned about fentanyl, because I think everybody is. It's been very sobering for me to hear about fentanyl time and again in different situations. And that includes even, through contacts with my daughter's school, that folks who are basically smoking cannabis, smoking marijuana, have run into fentanyl-laced marijuana and had problems waking up, have had to go to the hospital, things like that. So just random, running into fentanyl-laced weed is happening so often that it's getting to a parent like myself, who everyone knows is a child psychiatrist and doesn't like to talk to me about those things, but I'm still hearing about it. Fentanyl, I say it has an agonist stimulatory action at the mu much greater than delta and kappa receptors, but you have to remember that those receptors themselves, when they're activated, downregulate the action of the system they're attached to. So when you stimulate an opioid receptor, it is the thing that depresses the function. That's if that makes sense. And it also turns out that they have a weak stimulation action on serotonin, and very slightly reduce how fast your body throws out serotonin. It's not like an SSRI in that it's many thousands of times, less strong than that. But it is important to note that. Fentanyl, what makes it so scary for us is that it's immensely more potent than heroin or morphine. And so when it's laced into various substances or given directly, without proper supervision, can be, deadly and quite terrifying. It takes only a few grains of fentanyl to have a biologic effect. And so it can be mixed in and hidden in essentially anything. It can be liquefied and, spread on cannabis leaves. It can be added to any, vape liquid, anything like that. It can be mixed into alcohol. And when you mix alcohol and opioids together, that's a really potent combination. Also, there's this lovely effect now. So, fentanyl is being produced in various forms. It's not just the prescription type. Fentanyl is rather easy to make in illicit laboratories. And this number sort of surprised me. Dan Galanis, our state epidemiologist, calculated that fatal overdoses have increased 400% in the last 5 years, which is that's a healthcare emergency in my view. And even he was surprised by that. And now we're seeing rainbow fentanyl, which is supposed to be sort of attractive. It sort of looks like, Skittles, or those sort of colored Halloween candy. So attractive to younger users. And that's exactly what they're designed for. We've seen them here in Hawaii. They've been seized in a couple of different raids, and they're making it out into the community. I could not find numbers anywhere for the rate of how often fentanyl is lacing other drugs. And I think it's just because it's really hard to track. How do you even study that? Because most people don't know until after they've used something. And so you can't even check the concentration or even the source of that. So that's kind of a question mark for me. If anyone has numbers about that or more data, I'd love to know. So we're talking a lot about opioid overdose in community settings these days, and how to recognize it. So You want to recognize the symptoms. If someone is somnolent, difficult to awake, they have the kind of pinpoint pupils, open their eyes, and even if the light isn't particularly bright, you can shade the eyes and they still don't dilate. Their breathing is poor, the heart rate is low, they're cool or cold to touch, they can be kind of clammy, a little different than sweaty. That's sort of weird, cold, sticky sensation. And then you look at the nail beds and the lips, and also in the conjunctiva, the pink of the eye, to see if they're getting pale, blue, or gray. You can see different colors, but kind of bluish gray is the classic sign. What do you do? Well, call 911. Everyone uses some version of this chart, which is widely available online. And so you try and wake them. And then I would say, actually right there, shout, shake, waken, and turn them on their side. So get them into that recovery position you see on the bottom there. And that prevents them from choking, or, as we say, aspirating, in my business, breathing in oral secretions or other things which can cause, some other problems in their lungs. Call 911, and if you have naloxone, give naloxone. And I'm pretty excited about the growing availability of naloxone in communities, and I support its availability, because we can't seem to control the presence, and the random exposure to fentanyl that folks are having in various ways. We have to have some kind of response to it. So naloxone is going to be part of my kind of safety kit that I keep in the truck kind of all the time. If you're a provider, I recommend having, a kit with a mask, to give breaths as part of basic life support. Try and get your BLS certification or keep it current. Have naloxone on hand. It's helpful to have, all the safety equipment for yourself, including something to cover your eyes in case someone, vomits or coughs. And then, if they are having trouble breathing and can't control, their breathing and heart rate, I would begin, BLS. And then just stay with them until EMS arrives. Don't leave them alone. There's another kind of recent trend. I haven't seen it or heard of it yet in the high school population, but when things start in college, they always find their way into the high school population. It just goes down. And I'll poll everybody after the slides are done to see if anyone's heard of this, but BORG stands for Black Outrage Gallon. It's a recent TikTok trend where you take a gallon of water, you pour it out, you then mix it with some clear alcohol like vodka or Everclear, and then add some flavor packets or energy drinks like Monsters or Red Bull or whatever. And the mythology is that because there's so much water in there, it prevents hangovers and, is safer in some way. But it's still an enormous amount of alcohol. Drinking a half gallon of alcohol is a half gallon of alcohol, no matter how much water you drink. But this mythology goes out online, and then people begin to believe it because they saw it on TikTok or Instagram or whatever. So I don't know where this is going to go. It's sort of viral already in the college realm. I don't know if we're going to see it or if it's, popped up at UH Manoa yet. But folks are infinitely inventive with regard to rapid ways to consume an enormous amount of alcohol, and it remains very high risk behavior. Also, it's a good way to binge, which we know is a high risk for a number of problems, not just medical, but also at-risk behavior for being assaulted, sexual assault, being robbed, mugged. So very high risk. I say growing concerns here, but really I've sort of been watching synthetics, mostly with regard to synthetic cannabinoids for a while. Just sort of keep an eye. I thought it was going to be a really, really big problem. But it seems to have leveled off a little bit, and I think that mostly has to do with legalization of more traditional cannabis, or if not legalization, then really sort of community acceptance of a baseline level of use, and just not a lot of enforcement of that. But still, you can go out there and still get things like Spice and K2, Scooby Snacks. For some reason, there was a cluster of Scooby Snacks happening here. Kush, Chronic. There's a plant-derived alternative called Kratom. And then the bath salts thing, which resulted in dense psychosis and brain that looked like Swiss cheese, a serious brain injury. So they're all fairly dangerous because not only of what they do, but because of sort of how easy they have been to obtain. But I'm cautiously optimistic that because cannabis has become so much more popular and accepted, that they're no longer like really cool, or there's not a lot of drive to really go get those things when you can just smoke weed. So, harm reduction, I'll take some harm reduction. Vaping and e-cigarettes, they're made a concern, and this really refers to a mechanism of delivery. So if I'm doing an assessment with the youth and they say, they tell me they vape, I ask them what are they vaping and where are they getting it? Because it's so variable what you get. And some, vape what they get from friends. Some go in the store and just buy them and their ID isn't checked or anything. Some just take their parents, or family members, vape cartridges or e-cigarettes. So I really try and figure out what it is. Most of the time I run into youth who are using nicotine containing. There are non-nicotine juices, but most kids that I run into are vaping are telling me, that they're getting nicotine. And some have moved from smoking traditional cigarettes to vaping, on the theory that it's safer. And while you're not breathing combustion products, and so you might be getting sort of a safety improvement from that side, you're getting more nicotine by volume. A typical cigarette has about 8 milligrams of nicotine. Most cartridges and tanks contain now, especially, it's been going up every year, quite a bit more. So if you finish a cartridge in a day, you've probably had the equivalent of like between 5 to 10 cigarettes, depending on what it is you're consuming. And still quite a few you can go out and get, THC and cannabinoid containing liquids, both, more sort of commercially, but also kind of handmade, homemade mixtures. So again, talking about the delivery system here, and then we think about, okay, well, what is the actual drug? So is it nicotine? Is there a cannabinoid, THC in play? And then we think about, well, what are the risks and problems with that, if any? But the mechanism of delivery has its own potential negative effects. And I had a very sort of personal experience with this. Someone known to us ended up in the hospital for several weeks because of an acute lung injury. They have a history of asthma from childhood, and spent some time in the ICU thanks to a vaping-related lung injury. The CDC came out with their official definition: e-cigarette or vaping product use associated lung injury, EVALI. Which really, could you come up with something longer? But fair enough. The challenge here is history. So you always want to get a good history, and because the symptoms are very general. Shortness of breath, cough, chest pain, diarrhea, abdominal pain, fever, and fatigue. Well, that sounds a lot like COVID. And actually some of the imaging findings are similar too, including the classic kind of pneumonia, pneumonitis, and ground glass opacity. That's kind of also a COVID presentation. So you have to be really cautious and careful about getting a history from your patients if you're a provider. And if you're a family member or someone working in the community, even though COVID is sort of, the news of the hour, we have to remember that there are a lot of other things that can cause lung injury and a picture like this, and not just vaping either, but other things. So I wouldn't jump to any conclusions. But this can cause a really permanent loss of lung function and can be really tough for people and fatal for people with asthma or COPD. Protective and resilience factors remain the same. We haven't gotten any new, magical ideas about this, but we have to keep strengthening folks' community connection and involvement in pro-social, not just activities, but beliefs, like, family and youth and school communities really pushing and reinforcing those ideas. Those at risk include, those with housing instability or poorly housed, homelessness, family division, where they're, bouncing between environments and there's not really a consistent sort of set of messaging. Recent, but also chronic immigration is a risk factor due to the loss of that community connection. A pro-social and safe school climate, and not just with regard to substance use, substance use messaging and things, all very important, but also if you're not safe at school, or if you don't feel safe at school, then, kids will be find themselves kind of pushed to the sidelines, and into areas and in social situations where they're less safe and more apt to, get into substance use and other problems. I used to do environmental safety assessments of schools as part of my school clinic in Denver. And I've never done one here, although every time I visit a school, I'm looking at the sidelines, I'm looking for those hidden areas. Every school has them. And that's where people can really get into trouble. But also when they can't contact staff easily and get help, whether because of staffing student ratio, like I mentioned, or just the mechanism of asking for help is, difficult to navigate for a student. So it's really important to kind of make sure those are smoothly operating. That's part of the advocacy that we try and work with at our center. We always look at family relationships. So strong and healthy family relationships is part of what we do in my center. Risk factors include domestic violence, family substance use, always, of course, and abuse of really any kind, emotional, physical, sexual, neglect. Kids are they are need-based computers. They are going to get their needs met, however, and if they're not getting met at home, they're going to go somewhere else. Really working on those self-efficacy and resilience, personal resilience factors. So, strong problem solving, frustration tolerance, practicing, tolerating delayed gratification, working with creativity and boredom. I had this really good discussion with a parent the other day who's a nurse about the value of boredom. Kids don't like being bored, and so people throw things at them like video games and devices and things like that, and a little bit of structured, like someone supervising, in the space in the family home or whatever, but where they're challenged to come up with their own hobbies and activities to interest themselves, I think is underappreciated, and we need to be doing that a little bit more so that people train themselves to develop their own ideas and hobbies. And cultural connection, and this can include both like a cultural, ethnic, and historical connection and family connection, but also kind of spiritual cultural connection. No one thing is required, or better than another, but some kind of connection to community and a cultural identity has been shown to be protective. If someone has lost a connection with a culture of origin, or has a poor connection with their current, community, then that is an additional risk factor. That's the end of the slides. I ran a little bit longer than I wanted to on those. But we still have some time if folks want to throw out ideas, things they've run into, questions. And you can feel free to put it in the chat, and Danielle can let me know.
Yeah, I got a couple here. The first
Great.
one was, are you okay with sending me the slides and I can turn them into a PDF and get them out to everybody who attended today?
Absolutely, yeah.
Perfect. Thank you so much.
I tried to put, you know, the sources of most things. Probably wasn't perfect about it, but you know, none of it is like original, really, just stuff that I've been watching and trying to keep track of.
No, definitely. Thank you. On the topic of fentanyl, do you know what is the status of more widespread access and distribution of test strips?
I don't. And that's something that I need to actually look into myself. And what you're referring to is like you put like a liquid sample of something and it will color in response to the presence of fentanyl. I need to go out and actually just see if I can access it. You know, that's the best way, you know, to find out, because I'm told a lot of things online and then I go out and I try and get something. And that's like not available. So stay tuned, and maybe Danielle can blast out an update on that. But I think it's a really good question. And also naloxone availability, like, is it coming? You know, where's it going to be? How can I access it? Is there training? You know, I mean, there's following directions on a box, and then there's like actually sticking something in someone's nose and, you know, giving them something. I mean, there's a level of comfort to that. Even if you are like, yeah, I would like to save somebody's life, that'd be great. So I want to call our public health office and see if they might offer some training about that.
Yeah, I can give you a little update on the naloxone. Is that Maui AIDS Foundation does distribute naloxone, and they do training on it. So you
Yep.
just need to contact on Maui, the Maui AIDS Foundation, and then Hawaii Health and Harm Reduction as well. We'll do trainings on it, and we'll do distribution to you as well. I don't know about the test strips, but I think if I ask Hawaii Health and Harm Reduction, they might give us a clue. So thank you so much. We do have another question in the chat. Are you noticing any trends in Maui County specifically that fentanyl, and I think as you say this, xylazine, XYLAZINE combo have arrived in growing problems within the county?
I haven't seen that yet in the adolescent population, and I want to point that out specifically because some of the challenge we face here, I think, is a poor connection, communication with adult mental health support services and child and adolescent services. So like actually you just pointed out, right, Maui AIDS Foundation you know, is offering naloxone. We don't hear about that in the adolescent world, but I'll bet the adult folks do. And so we need to improve kind of our communication between these two groups of folks. We are overly siloed, and that's something that a lot of us kind of know about, but it's been hard to overcome. Adult Mental Health Division, which is sort of our counterpart at Department of Health, they operate very differently than we do, even though we share resources like the Crisis Mobile Outreach and stuff like that. So I think that that's something that we need to improve. But I haven't heard anything about that in the adolescent population. It's definitely a growing threat, and you know, out further out east and also on the West Coast, we're seeing more of it. I just don't know if it's really hit Hawaii yet.
Great, thank you. That's all I have in the chat right now. If anyone wants to unmute and ask Dr. Cole's question directly, you're more than welcome to. Or you can again pop it in the chat and I'll be glad to read it for you. Either one.
Hi, everyone. Thank you so much, Dr. Coles. I had the question about the fentanyl test strips, and I recall an organization, I think when I was listening to GIA testimony, that was Oahu based, that was I think their main focus was around distribution. So I'm sorry, I don't remember what the name is, but I do think that
Oh.
there's either a new organization or an existing organization that's trying to do that. So maybe we could find out who that is and see if they're going to have any success in bringing that to Maui.
Yeah, I hope so too. And it might be, good to sort of work with our organizations that are also have a distribution network set up for like naloxone, for example, to kind of piggyback, on that. I think it's the National Coalition Against Prescription Drug Abuse that are trying to get the test strips out there. Don't quote me on that, but I think. And also really our public health office, I think should be a primary distribution center. So I'll probably call Dr. Pang about that and ask if they've got if they're working on a system there for distribution of those things. Because I think, it's one of those harm reduction strategies, just like needle exchange, that I think can really save a lot of lives.
There was a bill in the Hawaii legislature, would have been this year, House Bill 573, that I'm not sure the results of that. I know we have Brian on the Zoom now. Brian, have you heard anything about that? That was in relation to legalizing the distribution of fentanyl test strips.
That wasn't a measure that we were particularly following, so I'm not sure if what the outcome of the legislation was. I know that this year has been a really challenging year for mental health and substance use bills and policies. A lot of things were just not getting heard in chambers, and but we can definitely look it up.
Thank you, Brian. Appreciate it. Yeah, we'll work on this, Dr. Coles and everybody here. We'll work on this and see what we can come up with.
Yeah, for sure. I think that's huge. I'm glad to hear that there's training going on for the naloxone. Probably gonna make a phone call and see if I can go get the training. I've done intranasal of other things. It's been a while, and it's always good to get training, even if you've done something before. It's good to go back to basics. I think also, speaking of basics, everyone who should get like BLS, because even if you don't have naloxone on hand, being able to support someone's cardiovascular system and breathing for them can save their lives until EMS gets on site and can give naloxone themselves. So go out and get your BLS certification and keep it up to date.
Awesome. Anybody else?
Is anyone seeing any stuff out there that I haven't talked about that is worrisome to you or was weird? I didn't talk much about cannabis or methamphetamine, other than those broad use patterns, changes that we've seen in the last couple of years, because, really the methods and pattern of use hasn't changed too much, other than thankfully the rates appear to be slightly down and lower than the mainland, but there aren't really any new delivery mechanisms or forms that are scarier or more dangerous than they were before. So I didn't really mention it as a new change or trend. But there's still definitely substances of concern. We run into it all the time. The increased sort of cultural community acceptance, of marijuana and cannabis in the youth population remains a concern, and it's sort of growing, and legalization, is growing across the country. And our main response to that really is educating around what are the effects of cannabis on the developing brain. And if you really see yourself as someone who's gonna smoke pot, maybe delaying as long as possible to let your brain finish developing, close to its adult, state before really getting into moderate to heavy use. So again, kind of a harm reduction model, and trying to provide good education, good information around what its effects are. So I do that a lot in my business, working with kids and families.
I have another question in the chat. Thank you, Dr. Coles. Is there any evidence yet that the anti-vaping campaigns are working with our youth in Hawaii?
They were sort of rolled in, but it looked like there was a slight reduction in self-reporting of vaping in the 2021-2022 period. Now, how much of that I think we're going to be crunching, folks are going to be crunching the numbers on, how much effect did COVID have on those numbers and people's access and things like that. So are we looking at an artificial dip or, a real thing? So hopefully the 2022, 2023 numbers will give us a real indication. I'm still seeing a very large, and this is anecdotal, not data, a very large number of vapes and e-cigarettes being smuggled into various treatment settings that we have youth in, of state contracted facilities. They're just so easily smuggled. So they're secreted into shoes and socks and bags and hats. There was an e-cigarette in someone's bracelet that they had actually made it part of the bracelet and it wasn't picked up. Personal search, so it's just, they're really clever.
Okay, thank you. I do know too that Ashley Kempler is the community coalition coordinator for the Maui Coalition on Drug-Free Use, and they know they've been doing a lot of work on anti-vaping campaigns along with Chris Mills from the Department of Health. She's been doing a series of updates on that. I put Ashley's contact number into the chat. She's always happy to talk to somebody if they're, want information or if they do want to become part of the Maui Coalition for Drug-Free Youth. We've, the Maui office, we've worked in conjunction with her before in the past. So I would, not hesitate to give her a call. And from Brian, we have the Public Health Institute is ahead of it, the anti-vape efforts and anti-tobacco efforts statewide, and is a great resource. Yeah, they really are, the Hawaii Public Health Institute. So they're very, very good.
Yeah, and I want to say that the tobacco and vaping education groups here are, I think, really strong and really active. In some ways, I think more active and effective than Denver, where I came from 8 years ago. I think just so energetic, getting out in the community, providing education in so many different venues. We get a lot of traction from doing family education. So I think early on there was this idea, this mythology, and I think it was promoted by the companies, that vaping was safer. And so parents were sort of thinking they were choosing a harm reduction model. I'd rather they vape than they smoke, bongs, joints, or regular cigarettes. And really we're trying to put the real data behind that, and talk about the risk of, real injury, real lung injury and other effects, and also the potency of these preparations, actually how much drug is getting delivered, per unit, or per cartridge is actually quite high. And once people know that, they're very receptive, to the information. It's not really, it's not shared much except in the super ultra fine print, on the underside of the back label of things.
Anybody else? We have about 10 more minutes or so. We do have a slight lull. I am going to drop our survey. I'm going to drop our survey into the chat. We do ask that everybody, if you have a moment to just open that up in your browser and do that after our training, we would really appreciate it, because it really helps us when we're planning our brown bag lunches. And we love the fact that Dr. Coles is willing to do 2 or 3 for us every year. And he's a valued member of Mental Health America's board of directors and our advisory board here on Maui. So we definitely appreciate you, Dr. Coles. Any other questions? Anything you might want to pop in the chat?
Well, I also want to pose really a question or a request. If there's something you thought I would talk about but didn't, please put it in there. We need this feedback. I want formative feedback on things you guys are concerned about, or topics that you would like us to talk about. In these brown bags, there's what we think is important. But again, that's just my perspective, Danielle's perspective on things based on what we do and who we work with. But all of you are really important, providers and folks in the community and in mental health. So put these topics in the chat so that we can kind of put them in our toolkit for the year, in the coming year, and planning our future brown bags. There's no pride or preciousness about what we talk about. So feedback is so important.
Most definitely. I agree 100%. Also dropping into the chat right now, while everyone might be thinking of another question. This is, oops, I've got the other one here. I'm going to put a link in here to our Finding Help page on our website. This is on our Hawaii website. You can find our Finding Help phone list here. And then you can also find a link to our national screenings. Mental Health America actually does mental health screenings that are for free. They don't diagnose, but they will give you some feedback on the information you put in. It's several different types of mental health conditions, as well as you could take a youth test for your child. The youth can come in and take a test. There's a parent test. So it's a really, really good access to maybe getting some guidance, maybe if you're just a little troubled on what's happening with yourself or maybe with your keiki. It's always good to be able to just open a door that way. And while I said that, I know it's perfect. Somebody actually put another question in. Thank you again, Candace. Perhaps including the Department of Health representative or perspective about what's being offered in schools for youth experiencing SUD, and how parents can work with the schools, as well as collaborations that are happening, and if any within the nonprofit schools address SUD.
Sorry,
Thank
that
you.
was more of like a suggestion, I guess, for future topics.
Yeah. Yeah. I mean,
I think that's a really good topic and question.
Yeah.
Different schools sort of have different programs for responding to substance use issues. Some collaborate directly with like Maui Youth and Family Services and their programs. Some have their own internal. Most of the private schools, have their own kind of internal model, or even have therapists on staff, or CSACs, certified substance abuse therapists on staff. So it's pretty variable, in the public school system, even between complexes, it can be different. So yeah, the only constant is change and difference. One of the things I've noticed here is here in Maui County specifically, is there are a few different graded levels of care. You sort of have a intensive outpatient model, and then kind of residential, which is contracted through us at the Department of Health. As far as I know, there's no real day treatment model for youth here. There are individual, substance use counselors out there, but you really sort of access those through individual insurance requests. But yeah, not very many like different levels of care to address the different levels of need. So we could use some development.
Thank you.
Yeah. And I know that many of the schools too are short on behavioral health specialists, which is unfortunate. Like every place else, they're short a little bit, and they working hard to try and rectify that situation. Also, nonprofits like ourselves, we go in and teach the courses from us with self-care for youth, talking really about protective factors for our youth, virtually just living in life, and our youth suicide and bullying prevention. But MEO also has a group that works into the schools as well with their own suicide prevention program, and they do some presentations regarding substance use. So I know that they, like both of us, we try to do outreach to as many schools as possible, but we can't hit every school.
Yeah, for sure. And again, going back to sort of fundamental drives, I like to tell a lot of people, especially if they're less comfortable or don't have a lot of training in, mental health or substance use disorders. I say, well, if you want to reduce substance use, reduce homelessness. So if you want to work with homelessness, and on that, you're actually also reducing basically everything else. And that just goes for kind of everything. Also did want to mention that Bobby Benson Center on Oahu, which is our primary residential facility, had historically been a little more, kind of substance use disorder focused, but really the last several years, they're a true dual diagnosis program. And so they address a kind of both a broader range, but a broader base of need for each youth who's there. And I think that they've done a pretty decent job at kind of expanding the way they think about things and how they formulate cases and work with kids. Their base tool set is DBT, dialectical behavioral therapy based tools and groups, which I think is good for a number of things. It's evidence-based for a few things, but it's good for a lot of folks, especially who are at risk for substance use disorders. So kind of it's reinvigorated my fandom of Bobby Benson. But we need more. We definitely need more.
And I just dropped the link in the chat if anyone wants to check that out.
Yeah.
Mhm.
And again, Maui Youth and Family Services, MYFS, they do a lot of work here, and they run the Safe House in Makawao for youth who runaway youth, but also youth who are in transition either back to home or out of home temporarily, for different reasons, or with CWS. So they work with a lot of at-risk youth. Great program.
Mhm. Excellent. Well, it's 12:58. If anyone doesn't have any more questions, we can begin to wrap it up. I really want to sincerely thank you, Dr. Coles, for always being available to us at Mental Health America of Hawaii and delivering some of the most pertinent brown bags that we can offer our community. It's a big asset, for everybody, I think, who attends, and it's something that we have continued to do here over the years, and we'll continue to do in the future.
Yeah, thank you very much, Danielle. Thank you, Brian, for being with us. And I'm sorry I had to miss Dr. Kawamura's presentation.
Yes, we had really good feedback on that. We actually just put it on our YouTube page, so that was wonderful. You can view it there, and that's MHA of Hawaii, which is our YouTube page. We have a couple mahalos in the chat. So thank you again, Dr. Coles. And with that, it is 12:59. We're going to give everybody a 1 minute back to your life today to do what you want to do. And please do something nice for yourself today, because you deserve it.
Thanks, you guys. Have a great weekend.
Thanks so much. Bye now.